Hi, beautiful people. How are ya? I hope you're having a great day. Neuromodulation therapy is most often known to treat disorders such as depression, diabetic neuropathy, dystonia, which is a neuromuscular disorder, epilepsy, essential tremor, hearing loss, Parkinson's disease, spinal cord pain, and Tourette's disorder. But it treats other forms of chronic pain, such as headaches, complex regional pain syndrome, and fibromyalgia. Today, I'd like to talk about neuromodulation therapy for fibromyalgia and the new device, in the last couple of years, called Quell Fibromyalgia. Here we go. Neuromodulation works by either actively stimulating nerves to produce a natural biological response or by applying targeted pharmaceutical agents in tiny doses directly to the site of action. Neuromodulation devices and treatments can be life-changing. They affect every area of the body and treat nearly every disease or symptom, from headaches to tremors to spinal cord damage to urinary incontinence. A couple of examples of this is a neurostimulation device where the application of electrodes to the brain, spinal cord, or peripheral nerves are involved. Also, pharmacological agents can be delivered through implanted pumps, and the drug is given in smaller doses because it doesn't have to be metabolized and pass through the body to reach the target area. These are invasive strategies because a surgical procedure is involved. And for people with fibro, these may be challenging to use, especially if the patient has medication allergies. There are non-invasive strategies too. An example is transcranial magnetic stimulation and direct current stimulation. These involve the delivery of magnetic or electrical current through probes that sit outside the head. Technological advancements are contributing to this field, but new devices are being developed regularly for people with chronic pain. In recent years, there has been growing interest and substantial progress in understanding the underlying mechanisms of chronic pain. Neuromodulation is the use of medication or technology to alter pain signaling in the body with the goal of reducing pain, improving function, and positively impacting overall quality of life. Neuromodulators may include devices that deliver amitriptyline, gabapentin, baclofen, or pregabalin, or some other medication directly into the body as an invasive treatment, or a device known as a TENS unit, transcutaneous electrical nerve stimulation, is often used, which is non-invasive. It delivers pulsed electrical currents across the intact surface of the skin to stimulate peripheral nerves to manage pain. In May of 2022, the FDA approved a neuromodulation device for fibromyalgia, the first time a device has been approved for fibro. It's called Quell Fibromyalgia. Have you heard of this? The Quell device is worn in a sleeve on the upper calf. It's non-invasive, where electrodes stimulate the sensory nerves without piercing the skin in the leg to trigger the body's pain relief response, easing symptoms of fibromyalgia. The device is lightweight and the treatment is customizable. It's only available by prescription, So a doctor must authorize it for patients with fibro who have a high pain sensitivity, and that's important. While it reduces lower extremity pain and other fibro symptoms, the nerves in your upper calf are stimulated using precise electrical pulses, neuromodulation. This nerve activity is hypothesized to activate a natural neurological response that reduces lower extremity pain. There are a group of peripheral sensory nerves in the area where Quell is placed, which are stimulated during treatment. Then the body's natural painkiller, endorphins, are stimulated. This is thought to interrupt pain signals and prevent them from being sent to the brain. It has a slightly lower pulse duration and voltage, so it's gentler on the patient. The exact biological mechanisms are uncertain at this time, as stated on the website. I found that interesting. But I do like it that you can monitor and control your own therapy through an app on your smartphone or Apple Watch, which wirelessly collects readings from the Quell device via Bluetooth transmission. That's pretty cool. On their website, you can click a link and have a consultation with a telehealth provider if you want to see if the device is right for you. If approved, a prescription will be generated and Quell would deliver the device to your doorstep. Or you can download the physician information sheet and talk to your doctor to get a prescription. Quell is drug-free, so pharmacological side effects won't occur, and it's easy for patients to set up, according to the website. You'll use a mobile app on your cell phone or a digital health experience. It can be worn while sleeping and can make recommendations for patients who have sleep difficulties. However, if you have a cardiac pacemaker, implanted defibrillator, or other implanted electronic device or implanted metal near the device, it shouldn't be used. It appears at this time that insurance isn't an option, so it's a cash pay basis. However, it is HSA and FSA approved, and you purchase the standard electrodes that have a soft gel that adheres to the skin. The starter kit is just under $300. For the neuromodulator, one wearable band, a charger, and a month's supply of electrodes. A 3-month refill supply is about $200, which includes the band that goes around the upper calf and the electrodes. Hopefully, over time, they may become less expensive if people find that they're helpful. I mean, my current insurance doesn't cover much of my CPAP supplies. That'll be different once I get Medicare, but I spend that much every 3 months currently. So if you're a person who has extremely high pain sensitivity, this might be an option for you, especially if you're unable to take medications. You only use it for about 8 hours of stimulation each day. That's about what I use my CPAP because I use it while I'm sleeping. And you can use this while you're sleeping too. It does say the system is meant to be used for at least 3 1-hour sessions every day, but patients can opt to do more. And apparently, the treatment also helps chemotherapy-induced peripheral neuropathy. So that's something. I mean, it does show that it works with people who have high pain. And according to fiercebiotech.com, the system's algorithms automatically manage the intensity of each therapy session based on the time of day, the wearer's body position, and sleep patterns, the possibility of desensitization over time, and even changes in the weather. So that's pretty cool. As As usual, research is conflicting, but I know that one person will use the TENS unit and love it, and then the next person will use it and hate it. But research does seem to show that TENS units can be helpful, and there are no side effects. This device, in some people, though, may cause a small rash under the band. Research on TENS units in animals show that a low-frequency TENS, when administered just below motor threshold, mediates effects via noradrenaline, serotonin, and opioid systems, and high-frequency TENS, when administered below motor threshold, mediates effects via noradrenaline, gamma aminobutyric acid, or GABA, and I guess that's either an S or an 8 opioid systems. For this device, Quell Fibromyalgia, there was no difference between sham treatment and the Quell, except for persons with greater hypersensitivity, and that's where it showed the most benefit. On March 13th, 2024, Neurometrics, the maker of this device, announced that over 2,000 fibromyalgia patients have been prescribed Quell Fibromyalgia since its strategic commercial launch in December of 2022. I'd like to know how many of them keep using it after that initial month. I suppose time will tell. So, are you using the Quell Fibromyalgia? We'd love to hear from you. I find it very interesting, and I'm interested in learning even more about it over time. Perhaps it could even help me with my feet. So, I hope you learned something. I send you gentle hugs and support. Love you.